ये W sitting was like a very big question. और वो होता है, बच्चा ना अपने आप W करके बैठने भी लगता है, तो अवॉइड कराना चाहिए या नहीं कराना चाहिए? And if you can tell a little bit what exactly is this W sitting?
Right. So the W position, most of the parents, they will either send me pictures, videos of their kids growing up when they have started sitting. They say they generally sit in a W position with their legs folded backwards. Is it good, bad? Is it something which is normal, abnormal? Let's understand a bit of how the body works. So when the child is growing, the hip joint is in a particular position. The hip joint, which in medical term is called as anteversion, which means that the hip is slightly in front, which makes it easy for the child to sit in W position. Can you do it at your age? Of course not, because as we develop in our age and as the child develops into 14 years, 15 years, 16 years, that angle of hip, the anteversion, will slowly correct itself. Once that correction happens, you'll not be able to do it. So the point of whether it's good or bad is a different thing altogether. Whether you're able to do it or not do it is the point. So the child will be able to do it, and that is why the child does it. Should you stop the child from doing it? Of course not. There's no need to do it. That is how the typical growth pattern of the child is. Some will have a flexibility more than the other, and they'll be able to do it more frequently. But is it a bad thing? Is it going to negatively impact the growth? Of course not. So it's a pure myth.
अरे लेकिन I clearly remember this, and it's a strong myth.
Yes.
You know what? Being a pediatrician myself, so you get these glimpses of information from here and there, and a lot of medical professionals do recommend कि नहीं आप मना कर दो बच्चे को, let them not sit like this, let it not become a habit.
Right.
But you were saying that
So if there's because it's a structural change, which is the growth part, and it is going to change, you're doing something or not doing something is not going to impact. But I'll put a caveat to it. The caveat is that if the child continues to do that, even after the age of 14 years, 15 years, then there is something which is now structurally established, which means that the hip will remain in that position. Right? So some children have a high anteversion, means the hip angle is more than the normal.
ठीक है.
So those could be a problem when the child grows into adolescent and adult.
Right.
Those are very few subset of patients. Less than 1% of the children will have it. But that doesn't mean that every child should, and your prevention is not going to change it.
But क्या ये जो 1% बच्चे आप बोल रहे हो, do you think it happened because of the?
No, absolutely not. That is how the body was designed. The genetics was such. Okay. इसलिए वो वैसा हो गया. आपके कुछ करने या ना करने से
कुछ फर्क
So please leave your child alone. Let him or her sit the way she wants.
And you know what? I mean, just personally, they look really cute in this scenario.
Yeah. So you should rather click pictures and
Absolutely.
post on Instagram than getting worried about it.
Then
Thank you for watching this clip from the Dr. Dad Talk Show. Be a part of our parenting community for trusted guidance and clarity.